Hey friends. Okay, I wanted to teach you some healthy respiratory protocols that can be used for anybody with an acute respiratory infection, any sort of upper respiratory infection, um, chronic asthma, emphysema, anything that's going on with the lungs. Maybe you're wheezing temporarily, or it's something that's been going on for most of your life. Um, this is a very universal protocol. That's my point. It is best and most effective and easiest if you have a nebulizer or you can borrow a nebulizer. If you don't, you can use a nebulizing diffuser, like what you use for essential oils in your house. Um, Ideally, the kind that you can put liquid into, and you can just stand over the stream and sort of breathe it in. So what you're going to do, I'm going to just tell you how to do it in a nebulizing, an actual respiratory nebulizer, which I think you need a prescription for most of them from your medical doctor. And if you have any sort of respiratory illness, you can get one very easily. I think there's also medical supply companies that you can find them online as well. So um, Silver Shield is a product I carry that is patented. It is antimicrobial, so it's antiviral, antibacterial, antifungal, and for most people who have asthma or any sort of chronic respiratory infection, it is an indication that you have an overgrowth of yeast or a disruption in the microbiome in your gut. So this is going to kill off the bad guys, and inhalation it goes into our bloodstream even faster than if we did something intravenously, and way faster than when we do things orally. So you can use things inhaled to treat, I can't say the word treat, so to support the body when you have things even as severe as cancer or whatever else, even chronic illness, fibromyalgia, chronic pain syndromes. This could even help that, because we're going to be talking about frankincense, and frankincense is such a universal, powerful medicine that also is antimicrobial. It rebuilds cells at the DNA cellular level and is just healing in every way, and is indicative of why it was one of the gifts for baby Jesus. So in a nebulizer, you're going to use 1 to 2 teaspoons of Silver Shield in place of like a liquid steroid treatment. You're going to use just one drop of frankincense essential oil. So here's what you need to know about using frankincense. It has to be from a supplier, a manufacturer that you know is safe for ingesting. So if you're using a company, a brand that you are absolutely certain is safe to use orally, then you can do this with that. Do not do this with frankincense that you purchase from a health food store, some random brand, or you're trying to save money, so you're buying a cheaper brand. Quality frankincense at wholesale cost should cost upwards of $60. So I sell frankincense that is totally safe for this protocol. I use it with patients all the time, and I'm going to share a really cool testimony with you here shortly. But so 1 drop of frankincense, 1 to 2 teaspoons of Silver Shield. So if it's more severe, go ahead and use up to 2 teaspoons if your nebulizing liquid container can hold that much, or just fill up the amount you would use with however much you were told to use with a steroidal treatment liquid. Replace that with the Silver Shield. And then for a child, usually if they're age 2 to 3 to about age 10, you can use 10 drops of this. This is called lobelia essence. It's a liquid form of lobelia. It's nature's, God's best herb for the lungs. It's a natural bronchodilator, so it's going to open up the lungs. So if you have a situation where the lungs are restricted or constricted, there's wheezing, trouble breathing, you need an inhaler on hand often, then this is what you want to add into there. So start with 10 drops. If it's a little baby, you probably want to only use about 5 drops up to about 2 years old. The bottom line is, the more severe the condition, the more you need to use. So you're not going to overdose on this if you're using 15 to 20 drops or less. So in a severe adult case, they might choose to use 15 drops or so. So I gave this protocol to my dad, and he's been doing it for about 3 months. He has had chronic respiratory problems most of his life, but as he's gotten older, it has been really much more difficult to breathe. And every time he goes for his annual exam and has his lungs and heart checked, they can hear crackling and wheezing. And he also sometimes feels like there's an elephant sitting on his chest. That's not good. So he's been doing this protocol for 3 months, and he just went to the doctor and got a report back that the doctor could hear no wheezing in his lungs. We had tried other respiratory herbs, Chinese herbs, concentrated herbs. We've done all kinds of cleansing and other things, but this was the #1 protocol that has worked for him. I have used this protocol even without the frankincense, just silver shield and lobelia, with all of my asthmatic child patients or asthmatic adult patients. I will have somebody, if you battle asthma and it is a chronic problem that you battle frequently, then you're going to do this protocol with the silver shield and the amount of lobelia that I told you. So if you're an adult, you're going to need 10 to 15 drops of lobelia with every treatment. You're going to do a breathing treatment, ideally twice a day for 1 month. And then in month 2, you're going to do this treatment once a day. After that, you just do it as needed. You can do this for any person in the family. So for me, example, I don't have chronic respiratory disease of any sort. But if I had a severe sinus infection randomly, I could do this just during those days that I had the infection to help knock it out quickly. And I would absolutely, most certainly, put a drop of frankincense in there. A couple other things you can do with the frankincense. Again, if this is you are certain of your brand. So I use Nature Sunshine products exclusively, and all of them can be purchased on my website at wholesale price, and you can order as much or as little as you want. There's no obligation to buy and no other gimmicks or anything like that. You just can start a wholesale account, order under me. You support my ministry. Thank you. I appreciate that. And you get better. And they test every batch, highest quality standards that you can get. And again, the Silver Shield is patented for high dosing long-term use. So when I give these protocols, I'm giving it to you as a licensed doctor that knows what I'm doing. So the frankincense, I also use this product 1 to 2 drops on the tongue to treat Candida overgrowth in some people, or if there's any disruption in the microbiome. If I know somebody has cancer, whether they're going through chemo or choosing alternative methods, this is one of the things I'm going to put them on. Now, hear me out. There's a whole lot more to cancer that is not covered in this video, but that is one of many things you can do, and you can increase the dose to 2 to 3 drops in more severe cases, and you're just going to use it more frequently throughout the day. But you can use a drop on your tongue to just help wake you up as a daily protocol, just once a day if you want. I do it almost every day, and my brain wakes up and it gives me energy, and I feel good. It's healing my body and keeping my body strong at the cellular level. I love frankincense. It's universal and covers a multitude of sins. So I think I covered everything. Hopefully that is hope and inspiration for some of you. A little side note, if you do order from me and you order the Silver Shield, make sure you get the big family size bottle. It's 16 ounces. You will always, always use this product. It is the #1 product to have people start their natural medicine cabinet with. So it's your antibiotic. If you're sick, you start taking it as directed. If you're really sick, double the dose. You can't overdose on it. You are not going to hurt anybody with it. It is safe for infants, newborns, and all the way up to the elderly and anybody with any chronic condition. So for the person that has 300 different allergies and they can't eat hardly any food, this is one of the things I'm always going to start with, because it not only kills the bad guys, but it leaves the good bacteria alone. It won't kill off your good microflora or the probiotics in your system. If you do have to take an antibiotic, you take the Silver Shield beforehand and during, and it will coat the good bacteria while the chemical antibiotic kills off the bad bacteria if you absolutely feel like you need to do that. And I cannot advise in a video because this will reach more than my patients who are under informed consent. Let's see. That's probably about all you need to know, but just know the more severe the infection, the higher the dose of silver. That's how you do it. You can also use 1 drop of silver in the ear or the eye at a time. You can do that up to a few times a day if you have pink eye or an ear infection. Amazing. You can save a child from being on an antibiotic in their first months or years of life, which leads to chronic Candida overgrowth and then can set them up for a lifetime of problems. So, Silver Shield is awesome, and again, also covers a multitude of sin. Can be used very, very universally, topically, and orally. So, bless you guys. Hope that inspires somebody today. Bye bye.